Hi, I'm Kelly from North Shore Eye Care. Thanks for checking out our video. Right now I'm sitting with Dr. Fay Knoll. She is an ophthalmologist here at North Shore Eye Care and she specializes in the cornea. I'm going to ask her a few questions and give her a chance to talk about her role here. So the first thing I want to ask you is what made you decide to become an ophthalmologist?
So I always knew I wanted to be a doctor. Growing up, I wanted to be a doctor. And when I think of a doctor, I really think more of like an internist.
Mm-hmm.
And then when I got to medical school during our clinical rotations, I realized that I really like surgery too. And after doing a few different rotations, I realized how great ophthalmology was because you do surgery, but it's also a lot of clinic, and it's really a unique field in that it's really the only field where you can see blood vessels and nerves without having to cut open anything. So you could just visualize it. It's a great field. It incorporates surgery and medicine, and it's
The best of both worlds?
Yeah, the best of both worlds.
Cool.
Exactly.
And how are you different than most other ophthalmologists, being that you're a corneal specialist also? How does that make you different?
So I do everything that a general ophthalmologist does, but I have additional training in cornea and external diseases of the eye. So in addition to doing cataract surgery and LASIK, I focus on the cornea. So I do things like cornea transplants and partial cornea transplants and LASIK. So I just do maybe a little bit more. I have a little bit more
Focus?
exactly.
All right.
On the cornea.
Great. So you did mention surgery. Do you remember a lot about your first surgery you ever performed? Do you mind sharing and
Sure.
what do you recall from it?
Well, I do remember my first cataract surgery that I ever did in particular. I was a resident. I did my residency at North Shore LAJ.
Okay.
And the first cataract I ever did was a completely white lens. Like this patient was hand motion vision. So it's kind of funny thinking about it because it's really a challenging case to do for your first case, but
Yeah.
this patient needed it. And I had my attending, you do it with right side by side with an attending. And it was so exciting because the next day, I remember when I saw him, the case went great, and the next day when I saw him, he went from hand motion to he was like 20/30 the first day.
Wow.
So it just solidified like how much I love it. You know, I love being able to help people see better.
Right, that drastic of a change in someone. That's amazing.
Yeah.
Great. What are some of the other, without elaborating too much because I want to sit down with you again in the future and kind of go over specifics, but what are some of the type of conditions that you see in your office as a corneal specialist?
Well, I see cataracts, but specifically with the corneal issues, I see a lot of patients with keratoconus, which is when the cornea is misshapen. It's more like a cone instead of like a sphere. I also see various kinds of corneal dystrophies, especially something called Fuchs dystrophy,
Right.
which is is hereditary. It can make your cornea get swollen and hazy and difficult to see through. And trauma to the cornea and scarring of the cornea and all kinds of corneal infections, ulcers, and herpes, believe it or not, can affect your cornea. It's more common than you think. The same virus that causes cold sores can affect your eyes. So I deal with all of those types of conditions.
Okay, so yeah, we'll definitely touch on the specifics another time. What would you say the most rewarding and satisfying part of your job is?
Hands down, the most rewarding part of my job is the day after cataract surgery or LASIK or cornea transplant when the patient's vision has dramatically improved the next day. And I've had patients start to cry. Just it hits them all at once. So that's definitely the best part of my job.
Right, to know that you were part of it and
Yes.
you made it happen. Okay, cool. Thank you so much for sharing. So if you would like to meet with Dr. Fay Knoll and you want to schedule an appointment, call our office at 631-265-8780 and she would be happy to schedule you and meet with you. Thank you.